Hello, my name is Katie McGinn, and I'm on the product marketing team at TeleTracking. We are excited to share the recording of a recent webinar where we had the privilege of hearing from two members of the Indiana University Health team, Darius and Casey, talk through their use of TeleTracking's data analytics platform, Synapse IQ, across the IU health system. For the last 3 years, Casey, Darius, and their team have worked extremely hard to align the data available in Synapse IQ with the challenges that they are trying to solve. During this session, you will see examples of how Synapse IQ supports a range of stakeholders such as bed placement, transfer management, and EBS teams. And now we will turn it over to Darius and Casey so they can walk us through a handful of their custom dashboards and reports that, as they say, were created and driven with an idea of action behind them.
Next slide, please. Oh, is that okay? So some general information that I would like to go over in regards to our dashboards would be the start of our target. So some of our stakeholders have been data analysts, nursing teams, EVS teams, and even executive leaders, some as high as our vice and even senior chairman. And our overarching goal for a lot of our operations have been to assist in bed placement, transfer management, EVS coordination, and also putting together a lot of actionable, tailored reports. An idea from our previous medical director was always to create reports and dashboards that were driven with an idea of action behind it. So the first dashboard we're going to actually showcase is driven with that idea. And this will be our executive throughput dashboard. This dashboard has been an overview of the facility status across the entire system, including census, holds, transfers, EVS and clean metrics, and even more. It has helped enable a quick assessment for communications within our regional leaders, as well as getting assistance for planning and transfer center operations and transportation logistics. It's been a central hub as well for either a daily operational insights in regards to receiving a scheduled subscription, as well as posting it for our Commander Style Center dashboards, again, with the idea of how quickly is it to see what's being done throughout the day on a regional system, or in some regards with the use of our filters from just a campus system or even regional. And again, this was our first dashboard that I built with joining the CBIA team and working alongside our previous medical director to put this together. It's one of our highest used and most favored by our senior vice president in particular. Next slide, please. So this would be our executive throughput dashboard. Not going to really break down too much here, but just wanted to walk through starting from the left on down on what we're being reported here to kind of get an idea of what it is that we're trying to showcase as quickly as possible. Starting on the left-hand side, upper left, we have our current census. So how are we doing on a hospital system in terms of our bed placements? How many staff do we have? How many occupied? How many unbedded? So this would be people who are waiting within our recovery, as well as those who have also just been admitted into the hospital and are still waiting to get a bed placement. So you can see this would be very important, just getting a quick overview of how we're doing with our current bed occupancy. And then quickly below that, how are we expecting our pending discharge and confirmed discharges? And then going down a few more steps there, we have a requested and assigned, and as well as our length of stay. How's the transfer center doing, and how did we do yesterday? And then directly in the middle here, we're talking our discharges. So this can help go hand in hand with the staff on the left-hand side. So the idea was just give you a little insight with the idea of putting this report together. You don't really have to look too far to see how am I doing with my discharges and how are we doing in alignment with our current census there. We have a list also of our observations. Ideally, how many patients are still being observed within that 48-hour 48-hour time frame to help prioritize, as well as how have we done within the last 6 months on average by weekday. So on Monday, in this case, with the applied filters, hypothetically Monday, we were expecting 32 at the time for the given filters. 32 is really low, so it's most likely just a single campus. And not to get too caught in the weeds here, That's the idea with that there. And then our discharge by transportation over at IU Health, and Casey, feel free to add any insight with this. We've been attempting to try and get more transportation assistance in regards to our discharges, just to overall help the flow of our discharge process there. And slightly below that, we do have just a visualization of how we're doing from a completed standpoint, as well as a confirmed and how many patients we're still waiting to get removed from our system. And then slightly below that, we also just have a list of completed transport jobs, and then as well as our EVS 90th percentiles too. So how are we doing from a cleaning perspective, turn time perspective? And as for those who may or may not know, this is also very vital because if a patient is waiting for a bed and they've been discharged, they can be discharged on time, but if it hasn't been cleaned and we have this patient waiting for a bed, that's lost time right there. And then we also have our active bed requests. So just keep track of how it's going by an hourly basis. Casey, is there anything you would like to add with this?
No, I think you did a great job covering it.
Can you
It's just, it
can you
was
talk
our,
about
oh, go ahead.
Yeah.
I'm sorry, I didn't mean to interrupt. I was going to say, can you talk about how this can be filtered out, campus, region, system?
Yes. So to save some real estate to help everyone's eyesight, I wasn't able to capture as much as I wanted. Again, this report and a lot of other reports are made to be posted on a larger screen. But at the very top, you can imagine a black bar completely straight across. And with this one, since it's a very basic level reporting, you can either filter by region, so our South Central region or our East Central region, as well as our West. And then from there, you can also filter from campus. And if someone wants to see all campuses, all regions, you will be able to set both parameters, regional to all, and you'll be able to set your campus to all. But the use of those two is if someone wants to see all campuses and they don't really care about the region itself, you would just mess with your campus filter. But if you wanted to see, say, a specific region on how they're doing. So our South Central, we want to see a view of that instead of everyone or just a singular campus. You can also view it from a regional standpoint as well.
I will add to this, Darius mentioned that our executive suite takes a look at this. And when they have it set to the whole system, they can clearly see how many staffed beds do we have for the entire system, how many are occupied, how many do we still have that are coming through to fill some of those beds. They can get a really good idea of how the system sits. Um, it's a good thing and a bad thing. I'll get an email every now and then that says, why do we have a big gap between the staffed beds number and the bedded number? So I answer that. Or, if it's early in the day, of course, you still haven't brought through all your OR patients yet. But it's also a great thing too, because when a particular area of the state calls our executive team and says, I'm in a bad way right now, they can quickly come to this report to see how true is that? How bad is it? Do we have the ability to decompress? And then they collaborate with us on a plan instead of just getting upset and, maybe causing a lot of chaos. It instills collaboration. We all have data that we're looking at, and now we can have a conversation on how to take care of that particular part of the state that's not doing very well.
Thanks, Casey. And for most of my other reports as well, of course, sake of HIPAA, there is usually a additional view of a patient list. So the idea there is that you don't have to click too far. If you don't want to have a separate report, you can just click to another tab. You can quickly see uh, an actual list of your patients by MRN or whatever the requested details were from our stakeholders and the report requesters. It's also for this particular sheet is broken down to a census count. So just how are they doing from a unit perspective? How are we doing with our confirmed? And let me see a patient count of those with our requested and assigned. So it's really to help keep that streamlined process and keep you in one spot to help track whenever important decisions or calls or interest a show like that. And that's what I have for this slide. So the next report that I wanted to showcase is also regards to our bed placement processes as well. This one is titled the Detailed Processing Analysis. This dashboard was put together to help track the journey from request to occupancy while focusing on several key stages. Uh, Going into the image, not just yet, but there are several more stages that I couldn't capture, but you're going to see an idea of what we're showcasing here. So, continuing with these points here, from a request to ready, request to assigned, request to occupied, and even assigned to occupied, to help pinpoint any type of bottlenecks and inefficiencies. Also helps to provide details and placement analysis, emphasizing on our turnaround times and pinpointing improvement opportunities. So it's really set to help streamline and improve our overall bed placement process within, from a system standpoint, regional or campus wise, or even down to a unit standpoint as well. Next slide, please. Thank you, Katie. So here, with the design of it on the left-hand side, we can see a little bit more of the filters. And again, each filtering system is dependent of what type of report they're looking for. But in this one in particular, we can see that I have it designed that if you want to come in here, you can look at it from a selective of different trend types, month, day, possibly hour. I know some of my reports go down to the hour, mainly for our bad placement dashboards, but not this one in particular. We could see the regional and campus, and even our lanes and origin unit and assigned unit. So going back to our executive throughput dashboard, where I set the horizontal bars at the top, you will see regional and campus. In this case, we have several more, but that one in particular, it will be set to all, and it's set to all for both campus and region. So it's saying that you're viewing all campuses and region. But if this was an interactive report, if you click the region button, you'll see a drop-down list. And if you click whatever region you want, the campus will be filtered to showcase only those campuses within that region. So as I mentioned before, we could see our request to occupied, request to ready to move, assigned to occupied, assigned to clean, request to assigned. And if you look a little closer, you can see some black bars at the bottom. Again, ran out of real estate here, but we'll even have request to clean and several more processes here. So the idea here is just to really get down and look into where are our bottlenecks and where can we and make some improvements. Next slide, please. And I actually remembered that here, this was a better capture of all of our different processes here. So again, request to ready to move to assigned, clean to occupied, assigned to occupied, and the list just goes on. And we have more inclusions of those same filters on the left-hand side as well. So with this view in particular, our system view, this was just going to showcase with the prescribed filters. And again, if there's any type of discussions at the start of these reports where there may be some filters that are implied dependent on who the particular stakeholders are. So your numbers can always differ. But from what we see from a surface level, we have assigned, these are the performance at the time, and a few of those squares or rectangles also have some green lines going down the line, and that is really just a quick indicator of what the target was. So you can quickly see who met target and who did not meet target. So again, bad placement, border placement has been a big thing for our system. So we're really trying to help hammer that down here. And next slide, please.
Hey Darius, before we move
Yes.
on, I just wanted to ask a quick question. So I know we're getting a full system view here, and I don't think we mentioned in the beginning just how many facilities are within your system. Would you be able to tell us, just how many you are so we can better understand, what this snapshot looks like and how much information you're getting within that view?
Yes. So, go ahead, Casey.
I can actually take that. So Indiana University Health, we have 16 hospitals across the state of Indiana. 6 of them are critical access hospitals. We have an adult level 1 trauma center, a pediatric level 1 trauma center, and 3 level 3 trauma centers, and multiple stroke and STEMI centers. I think throughout the IU Health system, we can do everything except for burns, and those patients will go to another hospital right in downtown Indianapolis. So that gives you a little bit of, we have everything from very large to very small. And just to comment on this particular report, many of you have used the standard reports in TeleTracking, and everyone loves the processing time analysis report, or at least we do. Our system loves that report. This was a way to put it into Synapse IQ and allow the user to really filter it in the way they needed to and pull a report easily prior to making decisions on throughput. And so this has become a very popular report, specifically in the southern part of the state. They use this day in and day out before making decisions regarding throughput.
And one more thing I wanted to add is that, again, like most reports, there is a patient breakdown. So this report in particular was created with a current and as well as a historical version. So if somebody wanted to see, hey, why is X, Y, Z so high? Or I just want to see what was the details of it doing so well, you can see historical as well as patients who are currently waiting today. And that's just to keep that flexibility throughout the show, well, throughout the usage for the day. And that's for this one. All right, so the next report is going to be it's going to be centered more around our transfer center and as well as our cases here. So that will be our lost, cancel, and declined report. This dashboard evaluates more unmet demand and assesses whether it should have been met regardless if it was lost, canceled, or declined. Aids in allocating additional space for service lines as well as enabling informed decisions about meeting demand. The report analyzes reasons for lost business between avoidable and unavoidable declines of varying degrees. It also tracks trends and declines, offering insights for service improvements and opportunities. Next slide, please. All right. And here is just a snapshot. And right now we're looking at it from a high level here, and that's mostly just by status. We could quickly see how many were lost, how many were declined. And on our left-hand side are just more additional filters. So to give a little bit of additional insight for me, I went to school for CS and I had an interest for web development. So you will see a few of my reports have a bit more of a focus on user experience. And what I really love about Tableau is how it really allows you to get creative with how you want to piece together your navigation. So in traditional Tableau, there's really thin tabs that I had mentioned earlier in the executive throughput dashboard that are sometimes hard to see. And Casey has commented before that with the implementation of these custom ones here, just these large tabs at the top here, it helps bring that attention. Hey, you don't have to open up another window. You don't have to go to another URL. If you just click those tabs at the top, you'll be able to seamlessly transfer in between those views depending on what you're looking for. Next slide, please. So to continue that notion here, the loss and cancel declined report is also separated into by disposition reason. So mentioned earlier, to what degree and help reinforce where we could have allocated our resources here to assist with those reasons by highlighting quickly, where has most of our discharges been, cases been declined, what were those reasons, if they were lost, canceled, et cetera. And additional insight in regards to the tabs at the top here, you were at case by status, and now you're at cases by reason. And then we can go one more over, please. Oh, well, I thought I had an additional slide with our trend there. So apologies in there, but that would be the most of our lost and canceled. And Casey, would you like to add anything?
Yeah, this particular report is helpful, again, when talking with service line leaders. We, any of you that do or have those conversations, you probably get as many requests as we do where they say, we want to know how many patients we're losing, how many did we not bring in, and how can we capture that? And when they just take a look at an initial report, they will have a tendency to believe anything that's canceled is bad, or that anything is declined is bad. So we broke this down so that we could have a better conversation with those leaders to say, not every canceled case is bad. Not every decline is awful. Let's take a look at the disposition reasons and understand, we don't want to just transfer patients just to transfer them. We want to transfer the right patients that need the right kinds of resources. So this report allows us to have that conversation and educate the service line leaders And then they will focus on just the areas that we can improve upon instead of just really trying to harp at just getting all of the loss canceled and decline to go away.
Thank you. And lastly, same idea with the patient list. If you had the case referral list, there was a tab there as well that would allow you to do that. And the last report that I wanted to showcase, this one is more of a concept design that I've showcased Casey. It was originally came to mind from a showcase of another discharge expediter from a different hospital that had came to speak with IU Health and give us a little bit more information from her discharge expediter role at her hospital as well. So this one is called the Milestone Report. It's tailored for clinical and discharge expediters. It was built to quickly identify discharge and milestone delays. So over at IU Health, we're really starting to make a transition in getting those milestones implemented and used more frequently throughout the process here. It provides also additional key metrics such as our length of stay and averages, as well as our discharge ordering process times, aiding to help assist in any quick interventions and help highlight any trouble areas to quickly get some hands over there. And it also tracks the milestone tracking, so aided to showcase all milestones by reason and average delay times regarding each reason to quickly highlight bottlenecks again within the discharge processing. And we wanted to showcase another report, but we just decided to saw an opportunity to go with this one. I'll have to admit that selfishly, I want to show this to Josh as well. So maybe he'll see something that he appreciates here, but this is our discharge reporting. So starting from just the left-hand side, moving across, and we're going to go down to the black area. We have our key metrics here with the prescribed filters that are added. This one, again, cut off a little bit to save the real estate space there, but no one has adopted it just yet. There are some talks about potentially the developing a team that might utilize it. So right now it's just at the stopping stage until someone else, decides to take a look into it, and then I can start to curate it more into what they want. But from a concept perspective, this is just what I believe might assist the overall processes here. So our average length of time for our currently vetted patients, the confirmed as well as the goal, and then in the average time of the duration itself. And then moving over into the center with our active milestones by group. The ideal here is just to quickly showcase which milestones are giving us the most issues, as well as how long are they contributing to our average delay. If someone wanted to, they can, of course, filter out those milestones if they just want to see particularly transportation, transition planning, or any of the other selections there. And then the active milestones by reason. Each milestone group has its own list of reasons as well. So pre-cert would have pre-cert pending, transportation would have several, and this was just a quick colored tree map way of just showcasing, again, what is our biggest issue here. And even though some people might prefer numerical, and some people might also like seeing a large quantity, like, hey, this is the one that's sticking out to you quickly and concisely. Moving on through the scatter plot, I did have to blank out some patient details just to comply with HIPAA law. But if you do hover over any of those dots, if this was an active report, it will showcase the patient's MRN, their details, pretty much everything that is highlighted on the right-hand side of patient details. But this is just, again, a quick visual cue that tells you, who has the highest active delay and also who has the highest confirmed timestamp. I can't quite remember with the color coding. I do believe that the deeper shade of red, it was more of who's been waiting the longest to get their confirmed discharge cleared out. I'm sorry, their length of stay. So who's waited the longest, but also has had the highest confirmed or even the active delay. And then lastly, if you click the patient, it will automatically filter the patient details down to that patient specifically. So if anyone wanted to use this throughout their day-to-day, they can click the patient that has the highest outlier, quickly see where they're located, and quickly send someone there to address the situation. And
This,
Casey, I'm sorry, go ahead, Josh.
well, yeah, this is a really great report. And the key thing about this report that makes it so good is that it contains actionable data. You're providing something to a group of people that can see an issue and take action on it. And it's not just collecting data for the sake of collecting data. So I think it's a great report.
Thank you. And
The
Casey as well?
milestone,
Oh.
yeah. We have certain areas of IU Health that use the milestones very well, and some areas that are really just beginning to get into it. The milestones in teletracking and their delay reasons were actually built and agreed upon by our system-wide integrated care management team. And they liked them so much that they have now gone to Cerner. We use Cerner as our EMR. They have now gone to our Cerner partner and asked that they change the form within Cerner to match the milestones and the delay reasons in teletracking. I think that might be complete around the end of this month. And when it is complete, the plan is to integrate that Cerner form so that each time there is a milestone completed or a delay reason selected in Cerner, it will automatically show up in teletracking. And then, of course, can be easily seen by any ancillary department or during any huddle, just what the delays appear to be, and hopefully addressed early in the discharge planning process.
All right, thank you. And that is what I have for our showcase today. So hopefully I took up just enough time and I wasn't too selfish, but hopefully you guys saw something that you might appreciate, got some ideas, or even have some feedback, as I'm always open to any to help improve what I'm reporting to, not only my system, but just improve as a designer overall. Thank you.
And that's it for this session. We hope you enjoyed learning about the importance of using data to make actionable decisions to improve your operations, and hopefully you were able to identify ways that actionable data can support your hospital or health system. If you want to learn more about how Synapse IQ can support your team, please email marketing@teletracking.com. Thanks for watching.